Hello, doctor.
How are you?
I'm great, and you?
Thank you very much.
Nice to meet you.
Nice to meet you too. Thank you.
Yes, thank you. Сейчас мы поговорим с доктором, главным врачом по ортопедии. Hello, doctor. Can you please tell about your specialization, about what kind of operation you make?
Okay.
Yes.
I'm, as you know, orthopedic surgeon. I'm specialized over arthroscopic surgery of joints, knee joints, ankle joints, and hip joints. We can perform here all kind of sports traumatology problems like anterior cruciate ligament ruptures, meniscal ruptures, and chondroid problems, and we can perform also meniscus transplantation from cadaveric tissues, and other problems like arthrosis and degenerative joint problems. We can make some joint replacement. We can put the new joints in degenerated patients' joints, and this is done for hip joints, knee joints, and also we can perform here vertebral problems, scoliosis, spondyloarthrosis, and degenerative lumbar problems, and also we can perform hand problems like nerve injuries, nerve entrapments, and we can perform microsurgical procedures also, and also big deal is the traumatology. We have here 4 different orthopedic colleagues, and we can perform all major trauma problems like pelvic fractures, long bone fractures, and spine problems, spine fractures, etc. And we can also perform tumor and pediatric surgery also. We can perform here all the time.
Can I ask you a question?
Yes.
Do you use stem cells in your practice?
Yes, we can do, but you know, the stem cell are not proven technology yet. There are too many scientific work on it, but there are not 100% proved or treatments. Then we have a little concern about that. We have to choose right patient for right treatment. Therefore, I have to aware the patients about these risks and benefits of treatment. But yes, we can perform in selected patients.
And what kind of material for joint replacement do you use?
We use prosthesis. As you wish, I can show
Yes.
some bills,
Please.
images from patients that we operated. I had already collected some patients' X-rays here in my computer, and I would like to show these joints. Here you see bilateral, both sides, knee arthrosis is a grade 4.
Yeah.
It's a very end stage of disease. We can perform this operation or joint replacement. As you see here 2 different components. Metallic component to the joints, articular surfaces are replaced with these metal component, and between 2 metal component we put an polyethylene plastic particle, and with this treatment patient can perform knee flexion, extension, and he can walk and perform daily life activities and light sports. But the main advantages is the pain release. Daily life is so much ameliorated, and the patients are extremely content with this prosthesis. Other types of problem I can show you maybe these kinds of very hip fractures and scoliosis patients. You can put some materials to restore scoliotic problems, and we can perform hip arthroplasty like this, and we can put here joint replacement in the hip, and also there are different joint problems. Like this patient, she has very well seen the X beam pathology, and we put in some material, external fixator, and we did ameliorate the patient's leg and correct her leg in this position. Okay, and
for how many years the patient can use the joint replacement?
Joint replacement, this is up to the patient, but minimum 15 years. But I personally see one patient who had an hip replacement 13 years ago.
That's
13
great.
years, very
Yes.
long time, yes. But it's up to the patient situation. There is no fixed date for this.
That's great. And for how long the patient need to rehabilitation after the operation?
After the operation, we keep the patient on our centrum for 1 week. During this period, we perform physiotherapy and a range of motion exercises, and patient then after is able to walk around without crane or crutches, and she can perform steps down and steps up from escalator. But then after she have to follow some physiotherapy, maybe after 6 weeks. The total durée or time that she need for this rehabilitation is 2.5 months. After that, patients are very happy, and she forget also that they are operated during daily life.
That's great. I very appreciate for your time,
Thank you
for
very
your
much.
interview.